Hello, and welcome to Concordia University Hospital. Fentanyl, a powerful prescription opioid medication used for severe pain, but also a dangerous drug when misused. Today we'll show you both sides: safe, controlled fentanyl use with proper education, and tragic risks of uncontrolled use.
Hi, today I'm the nurse for a patient that I'm going to be giving fentanyl to. Hello. Hi, Katie. Hi, Elle. How are you doing today?
Good, how about you?
Good. Well, I'm going to be your nurse today. My name's Kaylee. I'm just coming in to talk with you today because we are going to give you some fentanyl for your pain. How do you feel about that?
Fentanyl? I'm so nervous about taking fentanyl. Like, what is it for? I'm so nervous.
So we're going to give you the fentanyl. It's a strong opioid analgesic. So we're going to give that for you for your severe chronic pain. And it is also used sometimes after a major surgery. But today, because your pain is so high, we want to help with that pain.
Okay.
So I'm just going to pull up your chart here and pick out what we got here going on. All right, so a few things before I give this. I want to make sure that you know the symptoms that we're going to watch for. So the main things that you're going to watch for is drowsiness, constipation, might have some nausea, a little bit of dizziness, so we're going to watch when you get up, and then a little bit of confusion.
So this may make you sleepy then?
Just a tad.
Okay.
So we're going to keep an eye on that, and then we also want you to know to avoid that we're going to avoid any driving or alcohol, but we're in the hospital.
Okay.
So now some serious adverse reactions that you could have that could potentially lead to death is respiratory depression. So that is when you have slow, shallow breathing. And then some severe sedation, so if you feel like you're sleeping more than normal, having that low blood pressure, so once again, like we said, we're going to watch when you get up to see if you have blood pressure drop, loss of consciousness, and if there's any signs of overdose.
So Kaylee, I have a question.
Yeah.
What should we do if something goes wrong?
So if something were to go on wrong, I want you to call the physician immediately. So if you notice that she's having any difficult breathing, there's more confusion than normal, if she's unable to stay awake, so she's kind of drooping, any chest pain, if your pupils constrict, and then if you're noticing any of those normal reactions that come with an allergic reaction like swelling or rash. If you notice any of this, and especially if she becomes unresponsive or stops breathing, I do want you to call 911.
Okay. Thank you for that clarification.
Yeah. So it can seem scary, but for a controlled prescription use, fentanyl is typically used as a transdermal patch, or it can be used as a lozenge, nasal spray, or an injection. In your case, we're going to be using it IV.
Alright.
Currently while you're in the hospital.
Yeah, so how would I use it? As a transdermal patch then?
Oh, so if you go home and we give that to you as a transdermal patch, I want you to make sure that you change it every 72 hours.
Okay.
So you're going to make sure that the patch that you had before is removed. You're going to find a new area, make sure it's nice and clean, and apply the patch and label it.
Okay.
You want to avoid any heat on those areas. You want to ensure that you wash your hands before and after so you don't get any contact anywhere else. Make sure you dispose the patches by folding them together. And then also keep those patches locked away so that nobody else gets a hold of them.
Okay. So what happens if she misses a dose?
So as soon as you remember, I want you to apply a new patch for that pain. But never have two patches at the same time.
Okay.
Got it. Thank you so much.
Illicit fentanyl is extremely dangerous. Just a tiny amount can cause overdose.
Ma'am! Are you okay? Ma'am, can you hear me? Oh my god, I need to call 911.
Here you go.
911, what's your emergency?
Oh my god. I have somebody out here that just passed out. I saw her do the fentanyl. I think she's on fentanyl or something.
Okay, can you first check the scene for me to see if it's clear? There's
Yes,
no harm?
it's clear.
Okay. Can you try to stimulate her? Pinch her, shout at her. Are you okay?
Wake up! Wake up!
How's her breathing?
Slightly.
Slide? Okay. I'm gonna need to know where you're at. Can you tell me your location?
I'm at Reese Tower in the back of the building.
Concordia?
Wake up! Yes, of Concordia.
Okay, just stay with me on the phone. Help is on the way. You can
It's
begin.
very cold out
You
here.
not to perform CPR?
Yes, I do.
Okay, start CPR and help is gonna be on the way.
Okay.
Uncontrolled fentanyl can lead to respiratory arrest, pinpoint pupils, unresponsiveness, and death within minutes. Fentanyl can be safe when correctly used with medical supervision, but deadly when misused.
If you or a loved one is prescribed fentanyl, education and proper administration are essential.
Yes, I feel so much more prepared now.
And we know what signs to watch out for.
Use fentanyl safely, use it responsibly, and remember, just 1 minute with illicit fentanyl can be fatal.
Stay informed, stay safe.